following is a case study representing an elder patient that has severe xerostomia. Megan will be playing the part of a 42-year-old woman who has a chief complaint of possible gum disease. She has bad breath and her gums bleed, and she complains of very dry mouth. She has a plaque index of 35% and a bleeding index of 55%. She's taking multiple medications that cause her to have xerostomia. She brushes with a medium head toothbrush. Ashton will be playing the part of the clinician. This is a scenario in which recommending Biotin would come in handy. Hi Bertha, how are you today?
I'm good. It's good seeing you.
It's great to see you as well. How are your teeth feeling? Are you having any problems since the last time I saw you?
Well, my gums are bleeding and I have bad breath. My husband tells me, he keeps telling me I have bad breath all the time and he won't kiss me anymore.
Oh no, that doesn't sound good at all. Have you tried anything to reduce your bad breath at all?
Well, I floss.
Yeah? Anything else?
No, I only floss when I get something stuck in my teeth.
Okay, so pretty rarely.
Mm-hmm.
All right. Well, it sounds good that you're trying to take control of some of your issues that we discussed from last time. I also see that you're taking many medications that could be causing you to experience some dry mouth. Have you ever had any symptoms lately or pain contributing to dry mouth?
Well, I kind of get sores in my mouth and get cracks on my lips and I have to drink a lot of water. And my husband, I keep water by the bed and when I roll over, he gets really upset. My breath smells so bad.
Yeah, I can understand. That wouldn't be pleasant. Well, Bertha, from your last appointment, we got a lot of information from you, and I did find some things that I was a little concerned about. Is it okay if we discuss some of my findings and maybe give you some suggestions of how to improve your oral health?
Sure.
Okay, great. There are some issues we need to discuss regarding your oral health. Would you like to discuss your high plaque content, or your bleeding gums, or your severe dry mouth? Which of those would you like to discuss for today?
I think the dry mouth, since my gums have been bleeding and cracking the corners of my mouth, is just causing me a lot of pain.
Okay, all right. Well, I'm sorry that you're going through so much pain with this dry mouth. It's great that you're concerned with your oral health and you're trying to take action to improve it. After researching your medications, I believe that you do have xerostomia. Have you ever heard of xerostomia before?
My old dentist said something about it, but he never really explained anything to me.
Okay, well, xerostomia is just a large medical term for dry mouth. It's something to be concerned about. It contributes to a lot of things going on in your mouth, including cavities and periodontal issues with your gums, things like that. I'm glad that you're worried about this. It definitely shows that you're trying to take initiative in your care. There are some things contributing to your dry mouth. Is it okay with you if we go over these things that I've discovered?
Oh, sure.
Well, your medications that you discussed with me all have side effects of xerostomia. Actually, a couple of them do. They all do. There's no way to prevent xerostomia because you have to take these medications for your other health conditions that you have told me about. Have you ever used any aids to maybe lower your symptoms? Any types of mouthwash?
I just drink water.
Just water?
That's it.
Okay. What did you say? What kind of mouthwash do you use?
I use like a Listerine.
Listerine. Okay. Just the regular Listerine.
Mm-hmm.
Okay. All right. Well, I would definitely go ahead and advise you to stop using the Listerine. Actually, it contains alcohol, which adds into making your mouth even more drier. It doesn't help the situation, basically. So there are a couple other mouthwashes on the market today. There's a Crest Pro Health, which contains no alcohol, and also Listerine is putting out a Listerine Zero, which contains no alcohol as well. I have a couple samples and I'll give them to you, and that'll be good for you to try at home, see what you like, what flavors you like, and then you can take the bottle with you to the store if you find something that'll be easier for you to find. How does that sound?
That sounds great.
All right. Well, have you ever heard of Biotin at all?
No.
No? Okay. Well, it's a product on the market that's going to help in lubricating your mouth. There's different forms of it. I have a little sample I'm going to give you. There's a mouthwash and a couple other things, but the most important is this oral balance gel. it's going to be the best thing for you. It's going to help to lubricate your mouth, keep those dry cracks away, and all those sores. And again,
Is it gonna taste nasty?
no, it actually tastes really good. And what you're gonna do is just use a very small amount, a dime size. You just place it on your tongue, and it just does the work for you. It kind of makes your mouth nice and wet, and just you don't have to worry about those cracking sores or anything like that. It's also gonna help with the bad breath as well. So again, like I said, you just put a little bit on your tongue, and you're fine to swallow. It's not gonna hurt you or anything like that. So I do have some samples. I'm gonna give those to you and see if it helps. It is important to keep your mouth lubricated when your saliva is not being produced. Saliva helps to protect your teeth from cavities, and it kind of acts like a buffer to your acidity. So it kind of helps to lower your acidity of your mouth and help with decay. I would like for you to use this product, and then we're going to go ahead and check you out at the next appointment and see if there have been any improvements. So keep record. Tell me if you like it. Let me know what's working best for you. Because if it's not working, we're going to go ahead and possibly look into maybe doing a prescription, something a little bit stronger. But this should definitely help with your symptoms. How does all of that sound to you that I just mentioned? Does it seem like something pretty easy?
Sounds great. I think I'd like to give that Biotene a try.
Okay.
Especially since my husband doesn't kiss me. I really like it.
Well, we'd like to fix that for you too. All right, Bertha. Well, let's go ahead and let's get started with your appointment today.